Now let's talk about the different types of arterial disease. And let's start off with the chronic condition. Okay? No, the acute condition rather. So you have here acute arterial occlusion. So in or by definition, the acute arterial occlusion is presented by an acute loss of blood flow, meaning it does not gradually progress. Okay, acute po siya. To the peripheral arteries caused by a thrombus, embolism, or trauma such as crush injuries. Now, the most common location of the acute arterial occlusion is found at the femoral popliteal bifurcation. Now, when you are treating or dealing a patient with acute arterial occlusion, in terms of protocols, these patients are required to have immediate medical or surgical measures in order to save the patient's limb, which means that these patients are contraindicated to the following. For one, they are not allowed to do any exercises, especially on the affected areas. Take note ha, contraindicated. Also, the use of support hose or applying direct heat over the painful areas, prolonged positioning, and restrictive clothing. Okay, so again, with an acute occlusion, therapeutic exercise is contraindicated. So how can um, practitioners manage this kind of patients? So of course, again, they must have immediate medical or surgical measures, and that includes systemic anticoagulation therapy, thromboembolectomy, meaning they have to remove the thrombus or the embolus, or they have to undergo reconstructive arterial bypass surgery depending on the degree or severity of the condition. Okay, next you have your arteriosclerosis obliterans. So this one is a chronic, meaning it gradually progresses. Progressive inflammation with occlusion. Okay? Occlusion, when you say occlusion, there is clot formation that affects medium, take note, medium to large arteries, primarily caused by atherosclerotic plaque formation. Okay? Atherosclerotic plaque formation. Now, this ASO or arteriosclerosis obliterans is also known as chronic occlusive arterial disease, peripheral arterial occlusive disease, or atherosclerotic occlusive disease. Now, this is considered to be the most common form of arterial disease, where in fact, it accounts for 95% of all PAD cases. And it affects lower extremity compared to the upper extremity. Miss, bakit mas common siya sa lower X compared sa upper X? So, this can be supported by its application. Take note, di ba? In terms of anatomy, we cannot deny na mas marami po yung medium to large arteries in the lower extremities. So that could be a reason as to why mas common po sa lower extremity compared sa upper extremity. Now, in terms of age, of course, this can affect males more. This affects males compared to females, and most common po siya sa elderly patients. Now, what are the common risk factors associated to this? You have elevated serum cholesterol. When you say elevated serum cholesterol, the blood cholesterol levels reaches more than 200 milligrams per deciliters. Okay, again, greater than 200 na po milligrams per deciliters yung cholesterol or blood cholesterol ni patient. Smoking can also be a contributing factor, as well as pag hypertensive si patient or there is high systolic blood pressure. obesity, and diabetes mellitus. Now, the common arteries affected in ASO, the most common among all of the lower extremity arteries is your femoral artery. Okay, usually sa femoral artery po makikita yung occlusion. Now, the earliest sign for this is intermittent claudication. So when you will know if the patient is now developing arteriosclerosis obliterans if they present with intermittent claudication. Miss, unsa na siyang intermittent claudication? It is when a person or an individual walks or performs any kind of activity. Okay, for example, lumalakad siya or naglalakad siya for about 3 minutes. And after walking or doing any kind of physical activity, let's say after 3 minutes, he experiences pain. For example, in the lower extremity, the patient experiences cramping and aching pain specifically sa calf region. Sa calf region, it means sa bagtak ni patient. So, after 3 minutes, without any reason, nanglakaw ra siya. Okay, at a certain distance or at 30 minutes, and then afterwards, ni kalitra mag-cramp, there is cramping and aching pain sa iyahang bagtak or calf. Now, you will know if it is brought about by an ASO or arteriosclerosis obliterans or just a typical muscular problem. You will know kung unsay difference if there is resolution rather of the patient's symptoms when the patient rests. So for example, naglakaw siya 3 minutes, then there is cramping and aching pain sa iyang bagtak or calf region. Then, naglingkod siya, the patient tried to sits or rests, and it will immediately be resolved or madula or mawala ang iyang pain nga ma-feel. So, comparing it to a muscular problem, or let's say na ay musculoskeletal problem si patient, then the patient still continues to occur. But you will know if it's intermittent claudication if the patient at rest there will be resolution or the pain resolves. So that's intermittent claudication. Now that's the earliest sign of ASO. And this can also be applied to other chronic arterial disease, not only to arteriosclerosis obliterans. Now, the late sign for this if the patient or the patient's condition left untreated, okay, it leads to gangrene. Okay, so this is an example of gangrene because the tissues now or the distal areas no longer receive nutrients, blood supply because of the occlusion. Therefore, okay, it leads to at first it leads to necrosis, then later it will become gangrenous. And if that's the case, okay, pag gangrenous na yung limb ni patient, then there will be no chance of healing at all. That is why most of the cases there are subjected for amputation procedures. So, kailangan na pong putulin ang ganitong area just to save the other sections or the other parts of the limb. Okay? Again, pag gangrenous na. That is why physical therapy is very important alongside with medical and surgical interventions. Now, let's compare it to thromboangiitis obliterans because, 'di ba, by definition here, it is also a chronic inflammation with occlusion. Most likely, gradual din yung progression niya. Meron din siyang clot formation, but this condition affects now the small arteries. Okay, so which supports the claims that this tao is more common or the symptoms rather are more common in the upper extremity compared to the lower extremity,